As we wait for the final word from the FDA, we're answering your questions and concerns as part of our special series called The Best Shot. Janelle Bluda has some answers.
One person asked, is the COVID vaccine safe for nursing mothers? What about pregnant mothers? Professor of Infectious Diseases Dr. Luis Ostrowski says first you should ask your doctor.
The relative risk you have for having COVID versus the unknowns of the vaccine in this population. But in general terms, our OB colleagues are recommending to get the vaccine.
During the FDA discussion, they said there is growing evidence pregnant mothers infected with COVID-19 can have premature births and often pass along the virus to their newborns, who then must be hospitalized. But also in that presentation, they said there are currently insufficient data to make conclusions about the safety of the vaccine in subpopulations such as pregnant and lactating individuals. Pregnant women were excluded from the study, but 23 women did become pregnant during the study. 9 of them dropped out because of that. The rest are still being followed. But Dr. David Callender with Memorial Hermann says they want more information before they recommend it to their pregnant employees.
Right now, we're basically advising that our pregnant employees avoid this with this initial allocation. We'll take a look at those recommendations, see what other information is available, and then we'll make our recommendation.
Dr. Fauci has said new clinical trials involving pregnant and breastfeeding moms will likely begin in late January. So at this point, it's up to you and your doctor to make that decision. In Houston, Janelle Bluda, KHOU 11 News.